Hello India, very good afternoon to all of those who are joining me live on the Facebook page of News 9. I'm Neha. Now there have been various firsts that one got to witness due to coronavirus, which eventually became our habit, like maintaining social distance, sanitizing, washing our hands frequently and wearing masks, wearing them the right way and most importantly, wearing the right type of mask. Many often wonder if the mask they are wearing provides protection from the virus. Regarding that, we have got a fresh piece of information for you all. According to a study, cloth masks reduce the risk of transmission of viruses such as SARS-CoV-2, which causes COVID, but only if washed the right way. A fresh publication from researchers at UNSW Sydney advised daily washing of cloth masks with hot water to reduce the transmission of viruses such as SARS-CoV-2. Professor Rihanna, who conducted the study, says, quote unquote, both cloth masks and surgical masks should be considered contaminated after use. She further added, unlike surgical masks, which are disposed of after use, cloth masks are reused. While it can be tempting to use the same mask for multiple days in a row or to give it a quick hand wash or wipe over, our research suggests that this increases the risk of contamination, which is why washing it the right way becomes all the more important. The researcher reviewed unpublished data from a randomized control trial they published in 2015 and claimed that this is the only RCT ever conducted on the efficacy of cloth masks in preventing viral infections. Professor also quoted the WHO saying the body also recommends machine washing masks with hot water at 60 degrees Celsius and laundry detergent, and the result of our analysis support this recommendation, quote unquote. Now to understand more about it, joining me live is Dr Sitesh Roy. Thank you very much, Dr Sitesh, for taking out some time and talking to News 9. Do tell us, sir, does cloth mask reduce the risk of transmission of viruses such as SARS-CoV-2? Of course, if washed the right way.
Yes, Neha, certainly cloth masks make a difference, and that is why since March or April of this year, the WHO and all the leading organizations around the world suggested that people should wear any type of mask that they can lay their hands on, cloth mask included. However, like you rightly said, that all masks are not created equal. And when we select cloth masks, it becomes very important to have at least a 2-layer cloth mask, because clearly a 1-layer cloth mask may not always have all the properties or characteristics to prevent the SARS-CoV-2 virus, which is obviously small, only to be seen by electron microscopy for it to pass through. And in this process, the maintenance of the mask is equally important, because whenever we wear the mask and we go outside or we are amongst even 1 or 2 other people, there is a potential that if the virus were to settle on the outer surface of the mask, then that mask is considered contaminated and needs to be washed and cleaned properly before it can be reused.
Right.
Also, it has been found that the nature of the mask, so the type of material that is used for the mask, makes a very big difference to its efficiency.
Right. Doctor, break it down for the common man. What type of masks should one actually wear to keep COVID-19 at bay?
Sure. So when we talk about cloth masks, because those are the most readily available, and so far organizations around the world have said that leave the N95 masks for the doctors and the healthcare workers. The surgical masks are what is called the 3-ply surgical masks, are fairly freely available in India and are a very good option, and they do need to be discarded after a single use. When we come to the cloth mask, as I said, wearing a mask that is at least a 2-layer mask, preferably a tightly woven cotton mask. When I say tightly woven, there's something called threads per inch or TPI that is there in a mask. And this TPI should be above 400 or 500 for the mask to be effective. Because we have to remember that we may not be able to restrict the virus 100% from getting to us should someone cough, sneeze or breathe on us. But even if we can cut down 50-60% of what is called the viral inoculum or the viral dose, that enters our nose or mouth. That may be the difference between getting an asymptomatic infection or not being infected, and the difference between getting a severe infection and landing in the hospital. So I think that any mask will help. A 2-layer or a 3-layer cloth mask, which is a tightly woven cotton mask, will help more than a regular mask or a single layer mask. And a simple test for the general public: if you hold your mask up to the light or to sun, and if you can see light come through the mask, then that mask is not safe for you to wear. Because if light can pass through, the virus can certainly pass through the mask. So that's a very simple test. And secondly, washing the mask with hot water and a simple detergent is very, very important between use. And so people should have 3 to 4 masks at hand, where they use one, put it to wash, put it to dry, use the next one, and they rotate between 3 or 4 masks. That's what I would tell the public to do.
Right. Dr. Roy, coming back to cloth masks now, these masks are generally used for days together in a row. For how long really should one keep wearing the same mask, even after following all the precautions, like you also mentioned, that's washing it in the hot water, etc.?
So the answer to this question really depends on the material and the preparation and the type of fabric that is used. If you start seeing any fraying of the fibers in the mask, if you start seeing any loose ends, any fraying, then that is a time to change the mask. Generally, most cloth masks can be used for anywhere between 20 to 50 times, and sometimes even more if it's a very good construct fabric. But really, I would say that somewhere between 20 to 50 washes, it will start spraying and flaying its fibers, and that's when you know that you need to change the mask.
Right. Lastly, Dr. Roy, can people of all age group wear cloth mask, and does it really help in preventing the infection or protect the person who's wearing it?
Absolutely. I think cloth masks can be worn by all ages. We even have children. As a pediatrician and an adult physician, we recommend it to the children and the adults. Below the age of 5, some kids may not wear it as well, but it is still safe. And as long as they wear it, there is some protection. And there is no reason why an elderly individual also can't wear it. My suggestion would be generally a 2-ply cloth mask is enough for most people. 3-ply becomes a little restrictive in breathing. And in that situation, some of the elderly people or people with lung diseases might have trouble breathing. And I would suggest that no matter what the nature and type of mask, even if it is made at home with a good quality t-shirt cloth and home stitched, wearing a mask does save lives, because as I mentioned, it is the dose of the virus that gets into your eyes or respiratory tract or nose or mouth that determines whether you'll get the infection and how severe the infection will be. So any protection that protects you and also protects the other person from you, because if you are an asymptomatic carrier, you wouldn't want to transmit it to your friends or family or colleagues. So I think both ways, masks do save lives, and they need to be used correctly and maintained correctly.